Welcome to everybody. So this is the Family and Relationship Services Economic Evaluation using cost-benefit analysis to assess the value of services webinar. Thank you for joining today. My name is Jackie Brady, if you haven't met me as yet, and I'm the Executive Director of Family and Relationship Services Australia. Before we do start, I would like to acknowledge the traditional owners of the lands that we are all joining on today. If you wish, you're more than welcome to pop where you're coming from in the chat function. Sometimes that's a nice way to introduce one another through that function. For myself, I'm joining you from the lands of the Ngunnawal and Ngambri peoples, and I pay my respects to their elders, past, present, and emerging. And I do hope that the results of this weekend's referendum are positive. As many people say, voting yes certainly provides opportunities that aren't there at the moment. So we'll see what the weekend brings. Today we are excited to share with you the results of a cost-benefit analysis of family and relationship services, which FRSA commissioned the Centre of International Economics to undertake on our behalf. We recently launched CIE's report at our annual Strategic Leadership Forum, and FRSA members attending this forum were able to share the report findings with close to 50 parliamentarians and their advisors in a series of meetings held at Parliament House on the next day. To be honest, it was a really strong and powerful message to be able to deliver to parliamentarians that the family and relationship services are worth investing in, with a strong return of between $7 and $8 returned for every dollar spent. So FRSA commissioned the report in the wake of the Albanese government's 2022 election victory, and as with any new government in power, priorities shift and focus areas change. Within the social services portfolio, we are seeing a strong focus on the early years, and the Department of Social Services has indicated that sub-activities geared towards the early years under the Families and Children activity will be reviewed, and we anticipate that that will be forthcoming before too long. And at the same time, we have the government, through the Attorney General's portfolio, progressing family law reform to help ensure that the best interests of children are prioritised and placed at the centre of the family law system. In early March 2023, the family law service providers were advised by the Attorney General's Department that a review would be taking place, and that the terms of reference and the person appointed to that, Graham Head, has been announced in about September. So we have all of these review processes going on. So this report plays a very significant role in informing the value of our services. The approach taken by the CIE in the cost-benefit analysis is to measure the wellbeing impacts of interventions rather than just a conventional focus on avoided costs to government. I know that FRSA members in the social services sector more broadly view the services their organisations provide through a prism of enhanced wellbeing. And importantly, the Australian government is now also firmly focused on measuring wellbeing outcomes, along with traditional economic outcomes such as GDP, with the introduction of its Measuring What Matters wellbeing framework. The economic evaluation not only demonstrates the significant return on investment and financial and social cost benefits of family and relationship services, it also provides government with an important piece of evidence as it reviews those services and makes decisions on future funding and program design. We know that our members in the sector more broadly invest considerable time and effort reporting into the government's performance reporting system, the Data Exchange, or DEX, and we were therefore delighted that the Department of Social Services and Attorney General's Department agreed to provide the CIE with access to the relevant data to underpin the cost-benefit analysis. So therefore, it is my great pleasure to welcome Dennis McCarthy, who's the principal researcher on this project, to talk through the findings of the report. Dennis is an Associate Director at the CIE. He is an experienced economist focusing on cost-benefit analysis and statistical modelling, covering a range of sectors such as healthcare, disability and social services. So I'm going to hand over to Dennis now. I am going to go off camera, but I will come in at the end to assist with the Q&A session. So enjoy hearing more about this very significant report.
Great, thanks very much, Jackie, and thanks to everyone who's made the time to join today. I hope that you find this presentation interesting. As Jackie's introduced, we've used cost-benefit analysis to assess what the value of family and relationship services are. So what I want to talk through today is I'll give you an overview of what our task has been in the project and how we've approached meeting that task, how we're seeking to measure outcomes in the evaluation, how we then put a value on wellbeing. As Jackie has mentioned, we've taken a wellbeing focused approach to doing this work. Then some overall cost-benefit analysis results, which are about communicating what the value for money is from the services. And then we'll have some Q&A at the end. So as we're going, if there's questions that come up, put them in the chat and then we can come back to them at the end. So what's our task been? What we were commissioned to do was to estimate what the social and economic benefits are of family and relationship services. And we've used cost-benefit analysis as a tool or a framework to be able to demonstrate what the value for money is of these services. Cost-benefit analysis is the tool that we've chosen because it makes costs and benefits transparent. It's really about drawing from an evidence-based, in particular quantitative evidence-based, and we're able to bring together different sources, whether it's the extensive literature on the benefits of services or also data collections such as the DEX data to be able to substantiate assumptions and to drive results. One of the unique aspects of this cost-benefit analysis is that we're covering quite a wide range of services. Normally, cost-benefit analysis is a little more framed, and the previous cost-benefit analyses of these types of services have been a bit more specific, one or two services perhaps, or specifically about family dispute resolution and so on. But this cost-benefit analysis has been very broad. It's covering a range of different services, which you'll see there on the right, covering the full scope of family law services and a range of families and children activities services. How have we approached this task? I'll talk firstly about what we've done in terms of reviewing the existing work to date and developing the framework, and secondly about the new evidence that we've put together based on data analysis, statistical modelling, and the economic modelling that really underpins putting together the results for this work. So the first thing we did was, I think it was at last year's conference or the Strategic Leadership Forum, we ran a workshop where we presented and discussed a preliminary framework for outcomes from family and relationship services. The objective of doing this was to obtain feedback about how comprehensive that framework is. You know, part of doing a cost-benefit analysis is that you start with trying to be as holistic and comprehensive as you can be. As you go through the process, there'll be things that are unable to be measured or where there's data gaps and so on, but we sought to ensure that we're capturing everything at least in a qualitative way through this framework. It was also about identifying the relative importance of different outcomes so that we know where to focus our time, and also the chain of causation for how services lead to impact, which sometimes is very direct, but at other times it's a little more indirect. So in that framework, you'll see at the bottom those 6 dot points for the kind of the categories of impact that we had in that framework, which included economic and financial impacts, which are sometimes more focused on in cost-benefit analysis, but also a range of non-financial impacts like safety and feelings of safety, social and community outcomes, child wellbeing outcomes, empowerment, and also health outcomes. The second thing we did was conduct a review of what is quite an extensive literature really relating to the outcomes of these services. That included some research that's very specifically related to the exact services that are provided, such as previous cost-benefit analyses or economic value for money assessments of in-scope programs, but also more broadly at areas such as the psychology literature relating to the effectiveness of parenting interventions in general, both in Australia and overseas, and also surveys of parents using FDR services, for example. So really that literature review was as broad as we could. We then turned to collating and to some extent refining program logics that were provided to the project team by FRSA members. And so that process was based on a review of the literature and also feedback from the workshop to ensure that we had the chain of causation and the program logic really solidified for the various services. I mentioned that there's also a range of sort of data analysis and statistical modeling that we call new evidence. So down the bottom left, analysis of DEX data. It was really useful to be able to analyze DEX data for this project. And we did two key things with it. The first is we used it to measure the number of clients who are receiving services, not just clients, but also the number of cases, the number of sessions, information across states, information about individual and group clients, effectively getting a picture of what activity of these services looks like. The second thing was to analyze the score data from DEX to be able to measure what the change in client circumstances is from when people start to compare to when they finish receiving services. And this is really our key measure of what are the outcomes of these services, together with evidence from the literature and together with analysis of longitudinal data. So the information from DEX only included people who were receiving services, but we were able to use two longitudinal studies, the longitudinal study of Australian children, LSAC, and the Household Income and Labour Dynamics in Australia survey, two widely analysed surveys that have been running for quite a while that include sort of representative, broadly samples of Australians. So we used LSAC to be able to understand how people who were receiving family and relationship services, and specifically children and their parents, were impacted in terms of their mental distress, but also child development. We used the HILDA data to underpin how we're able to value changes in score. Basically, how do changes in score relate to changes in wellbeing? And I'll talk about that a little bit more later. The last step is sort of the formal cost-benefit analysis step. We effectively put together this information from the preceding steps and then estimate value for money. I'll discuss first some of the results that we found in terms of what were the outcomes that we see in score from services, and then we'll get to the cost-benefit analysis after that. So what we've done is we've compared the earliest and the latest client score where those are available for a client. Speaking first about family law services, you'll see in the chart, the horizontal axis is the change in score by domain, points out of 5. So, for example, family functioning here in the middle, for children's contact services, the blue line, there was a change in score of a little over 1 point out of 5, which is saying that, for example, people who received that service went from an average score of 2.5 to an average score of 3.5 after receiving services. That improvement of 1 point out of 5 is really quite large. In proportional terms, we're talking about a very material improvement. And you'll see that for family functioning, there was quite a significant improvement for basically every family law service. At one end of the spectrum, you've got supporting children after separation, where there was an increase of around 1.3. And at the lower end, it's the family relationship advice line, which is a bit under 0.5. The second sort of tier of domains where we saw pretty significant impacts from family law services were mental health, wellbeing and self-care, and personal and family safety. Again, impacts across quite a few different services. You'll see that there's quite a bit of variation. For example, for mental health, wellbeing and self-care, family law counselling comes out with the largest impact, together with the parenting orders program. Whereas for personal and family safety, children's contact services, family law counselling and the parenting orders program come out with sort of impacts around 0.5, which is also quite significant. Two domains where there were somewhat lesser impacts were age-appropriate development and community participation in networks, but these domains were important for certain services. For example, age-appropriate development got the largest improvement for the Supporting Children After Separation program. We haven't included domains for score here that where we didn't see differences in impact or where there were very few clients for whom it was measured. For example, employment, we didn't really see impacts on employment outcomes from family law services, so those aren't included in this chart here. The other thing we've done is, while Jackie quite rightly highlighted that we've taken a wellbeing focused approach and we haven't focused as much on government cost changes, For family law services, to get a full picture of what the benefits look like, we definitely needed to look at how it impacts diversion from court, because there's some very significant returns from avoiding people going to court where there's significant costs. So we estimated that between 70 and 80% of cases that are going through family dispute resolution, regional family dispute resolution, and families and relationship centres would have otherwise gone to court. And that sort of 20 to 25% who would end up in court anyway is based on how many are receiving the Section 60I certificates. So they're not diverted because they would end up in court anyway, was our assumption. This sort of approach to measuring benefits and kind of the broad magnitude of these benefits that we've gotten align pretty closely to some very recent work commissioned by National Legal Aid about family dispute resolution and other kinds of and legal aid. But there's a wide range of results across different cost-benefit analyses in this topic. So some work in 2009 from PwC saw around $9 to $13 of benefit for each dollar of cost, while work in KPMG around the same time saw around $1.60 of benefit per dollar of costs. So this illustrates something that we saw across quite a few different areas of the literature, that when people do economic analyses of these kinds of services, they get fairly different results. It's pretty sensitive to assumptions. As an example, in the PwC work, there was an assumption that self-represented litigants had a 20% higher cost when they ultimately do go to court. So these sort of different assumptions can impact the results. We end up with fairly significant benefits from court diversion, as I'll talk to later. The impact of the families and children activity in terms of score covered many more domains. So this chart is similar to the one previously that I showed for family law services, but there's a lot more domains here because we saw impacts across a wide range of outcome domains. Employment's there listed, for example, which has a relatively smaller impact, but yeah, it's much wider spread across the domains. Starting with the most strongly impacted domain, family functioning improved for almost all services, one exception being budget-based funded program, but there were some very significant improvements. You'll see the horizontal axis here is a little bit larger than in the previous chart because, for example, the specialised family violence services program was getting improvements over 1.4 points out of 5 on average for family functioning, which is a very significant improvement. Age-appropriate development had the largest impacts from the budget-based funded program, but also communities for children facilitating partners, Reconnect, and other services. Mental health, wellbeing, and self-care, we see from this evidence from SCORE that there were very significant improvements. We've also supplemented this, as I mentioned before, with some analysis of longitudinal data. The longitudinal study of Australian children, our analysis of that suggested that there's reduced psychological distress among people who are receiving services such as those in the family and children activity. So that was one instance where we're combining evidence across a couple of different sources. Some of the other domains where you see very significant impacts would be community participation and networks, which had the largest impacts from Reconnect, but also CFCFP and children and parent support services. Another one is personal and family safety. I mentioned specialised family violence services. That's really where this has the largest impact, and it's in fact the largest impact out of any domain from any service. Reconnect has impacts across a wide range of domains. You'll see that pink bar is quite significant across education and skills training, employment, financial resilience, housing, basically on every category. So it's sort of got a lot of different categories of impact. So with this information about how client circumstances are improving based on SCORE, how do we take this and then value impacts? So our overarching approach has been to try and use SCORE for a range of reasons. Two of the key ones being that it's a consistent measure of impact across programs. Having a single, because we have so many programs to look at, having a single way to measure outcomes proved to be really important to make the task manageable and to have some consistency in terms of how we're doing this evaluation for different programs. But also because we have data about earliest and latest SCORE. Sometimes when we have outcomes from services, it might just be what people's situation is at the end of receiving services rather than a before and after. I'd highlight that comparing before and after is not the highest standard of evidence. Randomized controlled trials, for example, rely on not only comparing how people change before and after receiving, say, counselling services, but also comparing to a control group. So I'd just note that here we are comparing earliest and latest score for the set of people who receive these kinds of services. We don't really have a control group in the same way as something like a randomized controlled trial. But nonetheless, we think this is a very significant piece of evidence that we're getting from SCORE. So we thought it was very suitable for this process. We've got two approaches to valuing changes in SCORE. The first is for age-appropriate development and family functioning. These have particularly long-term impacts on people's lives, particularly because they're affecting children. So for that, we've relied on estimates from the literature of benefits over the life course from these sorts of improvements. For family functioning, we have some Australian evidence from an Access Economics study in 2010. And for age-appropriate development, we're relying on some evidence from the UK about a parenting intervention and how that affected child development. So there'll always be some limitations when you're applying literature from overseas, but we think it's quite relevant here and has very high quality statistical methods. So we're confident that's a good approach. For other domains, for example, employment or community outcomes, we've used a subjective wellbeing approach. So how are we putting a dollar on wellbeing outcomes? How are we saying what's the value in a cost-benefit analysis, which is all about dollars in some sense? How are we saying how much wellbeing is worth in that sort of framework? So what we've done is we've focused on subjective wellbeing measures that come from surveys like the Household Income and Labour Dynamics in Australia, or HILDA survey. So in surveys like HILDA and many others, this is quite a common question now in surveys like this. Respondents are asked, all things considered, how satisfied are you with your life? Pick a number between 0 and 10 to indicate how satisfied you are. That question proves to be very useful because you can compare how satisfied people are based on their answer to this question, depending on other aspects of their circumstances. For example, are they employed or not? If they've recently lost a job, recently experienced violence, the extent to which they feel safe, the extent to which they feel lonely. So we've used this answers to this question and answers to those other questions, such as how safe you feel, to kind of put a link between SCORE and wellbeing. A 1 point increase in this score is worth around $26,500 for a person for a year, which is based on UK guidance. In Australia, in the cost-benefit analysis guidelines, subjective wellbeing isn't highlighted, and there's not a prescribed approach. Whereas in the UK, this is a prescribed approach. Also in New Zealand, it's much more normed. So this little diagram at the bottom is a little more technical, but it's effectively showing what our process is for putting dollar values to wellbeing outcomes. And the gist of it is as follows. We start by estimating what the change in score is. For example, personal and family safety improved by 1 point, or roughly 1 standard deviation based on our measures. Then we assume that the impact of that change in score is the same as a proxy variable from HILDA. So improving personal and family safety score by 1 standard deviation gives you the same wellbeing impact as an improvement of satisfaction with how safe you feel from HILDA. Using this kind of proxy approach is very useful because we don't know what the exact impact on wellbeing is from score changes, so we need to kind of create a proxy. We then estimate what the impact of a 1 standard deviation change in how safe you feel is on life satisfaction and apply our value of $26,000. So, for example, we estimate that there's a $5,000 value for improving the safety score by 1 point for a year. What were the results of the cost-benefit analysis? We find very strong results supporting, a strong case for the value for money of these services. We find that there's a net return of $1.4 billion per year from family law services. So that's saying that after taking off the cost of providing these services, the total benefit to society, including wellbeing and the government cost savings, is $1.4 billion per year. For the families and children activity, we find a somewhat larger benefit a net benefit of 2.2 billion per year. The net benefit is also calculated for each different type of program, and we get fairly wide-ranging benefit cost ratios going from $2.50 per dollar spent to as high as $21.90 in benefits for every dollar spent. You'll see on the right there, we've noted key finding is that all services provide benefits that exceed cost, or rather all programs. For family law services, you've got a return of just under $8, and for the families and children activity, you get a return of just over $8 for each dollar invested. We'd argue we've been conservative. A key instance of that is that we don't seek to include score benefits associated with group clients because it's proved quite difficult to measure and value those. We've also tested our assumption against least favorable alternative assumptions, and in all cases of that sort of testing, we find that benefits do outweigh the costs. This slide gives a picture of what total service activity and funding looks like. That drives a cost-benefit analysis because what I've been talking about earlier is really what are the benefits per person, but we need to know how big is the entire sector, how many people are receiving these kinds of benefits. So these results on this slide reflect the latest available data from DEX about activity, but also funding data. Based on that data, we see that there's 1.29 million care sessions that were provided in 2021-22. 484,800 clients received at least one session of care in that financial year. And there's more than 580 million in committed funding for the most recent financial year, which in 21-22, we estimate a cost per person just under $1,200. There's also been an increase in the amount of dollars funding per client over the last 5 years, although that's there's some caveats associated with that because we did also see that client numbers have reduced over time, which really drives that. To explain a little bit more about that, 1.4 billion from family law services, this chart sort of shows how that is built up. I mentioned age-appropriate development and family functioning, that we estimated those benefits based on information from the literature. Where you end up with for that category is around 0.4 billion of benefits. Adding to that, there's the mental health and wellbeing benefit of 0.2 billion, improved personal and family safety of 0.3, other score domains, which for family law services were sort of smaller, of 0.1, and then the avoided cost of family court, which is also quite significant. And you'll see that the cost, this red box, is 0.2 billion. So looking just at that 0.2 billion box, you'll notice that the combined effect of age-appropriate development and family functioning is larger than the cost of these services. Even personal and family safety alone is larger than the cost, and the avoided cost of family court is sufficient to justify that cost as well. With all these things added up, you get a very significant net benefit and a very significant return on investment. For the families and children's activity, we see a fairly similar picture, although it's much more dominated by the benefits of age-appropriate development and family functioning. It highlights the importance of those outcomes, particularly because they're sort of lifetime outcomes. So age-appropriate development and family functioning deliver a benefit of 1.4 billion across the families and children activity services. Community participation and networks, 0.3 billion, housing, 0.1, mental health and wellbeing and personal and family safety also make significant contributions. There isn't a government cost category here. We didn't measure court costs, obviously, for the families and children activities, so it's just about these wellbeing impacts. And they're more than sufficient to outweigh the costs of 0.3 billion that we estimate for these services. So you arrive at a net benefit of 2.2 billion. I mentioned that across programs, there's quite a bit of variation in terms of what the return on investment looks like. The returns do vary across programs because they're doing different things for different people, and costs vary to deliver these outcomes. So we probably encourage a bit of caution with too strictly interpreting the differences across different programs. You'll note for family law that family dispute resolution, family relationship centres and regional family dispute resolution come out looking quite high, and part of the reason is we've got a good picture of what the government cost savings are for those services because we've relied on these estimates of court diversion. Some other services like children's contact services, we don't have as much information about government cost savings to do with that service, and so this only really reflects the wellbeing improvements of that. Nonetheless, the key takeaway in our view is that across the range of family law services, you're getting positive benefit cost ratios. You've got, even still for children's contact services, and parenting orders program and supporting children after separation program got between $4 and $5 of benefit for each dollar invested, which is really a very positive result. It's quite a lot better than the benefit cost ratios that we see for large transport infrastructure projects and the like, which are much closer towards 1 even for sort of fairly well supported projects. So there's certainly very strong results. The families and children's activity, you've got more variation. One outlier is the budget-based funded program, which comes out very positively, particularly because it's delivering so much benefit in terms of age-appropriate development. CFCFP and specialised family violence services also come out very strongly. There's a few services that have less strong results, although they're still strongly positive. Family mental health support services, forced adoption support services, and National Find and Connect. For those, part of the reason that they come out not as high is because we've been a little more conservative with some of the mental health benefits that we've measured. In particular, there's probably some upside in terms of cost savings for government from avoiding mental health conditions and improving people's mental well-being. Nonetheless, those come out positively, which again, I'd highlight that that's probably the key takeaway. And now I'll pass back to Jackie just to lead on for some questions and discussion of the results. Thanks.
Dennis, one of the things I think too about the report and the work that you did was that it was quite often I have heard you say it's been quite conservative because a lot of the work is essentially based on not assumption, but assumptions really, aren't you? Your methodology is that you're assuming some things, but essentially that you have been quite conservative. So did you want to speak to that a little bit? And I think also too the fact that from your experience in this world where economists do this stuff all the time, that the results are very strong in terms of the cost benefit analysis. You don't see this, very often returning figures at this sort of level.
Yeah, I think in terms of being conservative, our nature as economists is almost always to lean on the side of being conservative. We think that it's certainly possible to look at to do cost benefit analysis and to sort of aim to get a particular result, and it's definitely not what we've done here. I think there's really good evidence to support the pretty significant benefits we've seen, and it's more on the side of, well, where we've got a choice of an assumption, the group clients assumption being an example, we've erred on the side of what's going to produce lower benefit numbers so that we can be left with a number that we're very confident in, that it's demonstrating a high value for money. I'd say one of the areas that we've been particularly conservative in is what I mentioned a little bit before about mental health impacts, particularly government cost savings to do with mental health impacts. For mental health, we relied on analysis of those longitudinal studies where we're able to, with a really strict sort of control group and using really high quality statistical modelling approaches, come up with what we think are really robust findings about how these services are improving mental health of people who receive them and their children. And in terms of how these results compare to results that we see in other sectors, it's very common for, I would say, for large infrastructure projects to have benefit cost ratios that are even below 1 and still be supported. There's a lot of marginal projects that get invested in society for a range of different reasons, and often those cost benefit analyses are sort of mostly relying on financial impacts, things that we can observe in markets and dollars that are sort of easier to arrive at. But I think one of the strengths of these wellbeing approaches is that we're able to bring the rigor of cost benefit analysis to social policy and to really demonstrate in a way that's got rigor and credibility what the returns are of projects and programs that have been historically less well funded. So yeah, it's certainly very strong results. Seeing numbers around 8 to 1 for the benefit cost ratio is not too common, but as you've said, we've been conservative and we feel confident that that's a good representation of the strong value for money that's offered by the program.
Thanks, Dennis. Yeah, I think that there's, apart from these inquiries and so forth that are going on and reviews about the specific programs, there's also a conversation that the Department of Social Services has initiated around, the community sector more broadly, and part of that conversation is about adequacy of funding. And I think also too the work that you've done for us previously when we were fighting for the SAC supplementation, that CIE did for us, certainly does demonstrate that funding hasn't been keeping pace, hasn't been keeping pace with costs. So I think even though that's a few years old, I don't feel that it's not relevant anymore. So I think the two pieces do put us in good stead to be pursuing those, those lines of advocacy. And so then also, Ellen, you'd asked the question about this is all useful, but what does this now mean in terms of the advocacy pitch? I think that if you are a member of FRSA and you're on the line, I'd encourage you to get in contact with us. We did certainly, as part of the work that we were doing during the Strategic Leadership Forum, we did put together a bit of an advocacy pack. So we have got essentially blank form or pro forma letters that people can use in their local area with their local politicians, where they can put in, the stories, because I think that that's the thing for me about this particular report. It tells us the bigger picture scenario about the findings. And I think the benefit that services can do is you can put faces to the figures and you can tell the real life stories of the figures. So I think the report goes very strongly into demonstrating not only value in cost, but as Dennis was saying, being able to highlight the improvements in mental health and wellbeing and other things like that. But it is the stories of the people and the experience of the people that have very strong resonance when it really comes down to it. So, I would very strongly encourage people who are interested to get their head around the report. The report itself is available online. There is an executive summary, which does give you, I think it's about 12 pages or between 8 and 12, which gives you a very strong snapshot of what the report's all about. And use it to your best advantage at a local perspective too, I would suggest. So I think I did see something. So the report that I'd referred to, or the work that DSS is doing around the community sector more broadly that we'll be feeding into, Robin's just popped a post in there into the chat function. I'll also ask Vanessa to pop in the link to the full report, which I'm sure was probably part of the information about joining this webinar, but also an email for us here at the office if you wanted to access some of the information that we've put together for our members. The other thing is too, because we came right down to the line or the wire when we were finalising this report to release at the Strategic Leadership Forum, we did only deliver the executive summaries to the Commonwealth politicians. So we're just about to finalise a print run where that's concerned. I know we have the soft copy, but I've got to be honest and say I still think that there's merit in a hard copy document with a letter landing on someone's desk because of the sheer volume of email that's received these days. So as soon as we get those in next week, we're anticipating we'll be writing out again to the Commonwealth politicians, federal politicians, to make sure this is on their radar. So it is a resource that's available to you. And if you wanted to talk through with any of this, either myself or Robin or Vanessa in comms about how you might use that or how you might adapt your usability of it for your local situation, then please don't hesitate to be in contact with us. So I think, Dennis, on the back of that, we've done well. essentially, and we've held the crowd, which is really good for the time. So I'm sure that everybody has valued hearing it direct from you in terms of what's in the report. So my thanks again to you for your commitment and dedication to the project. You really have, I feel, given quite a significant personal commitment to the project. So we're very grateful to you for that. So thanks everybody for being with us today. And any follow-up, just contact the office here in Canberra. Okay, thanks, Dennis. Bye,
Thanks.
everybody. Bye for now.
Bye, everyone.